Bagot na ba kayo dahil sa lockdown? Swimming na ba kayo kasama ang mga barkada nyo? Nasubukan nyo na bang mag-scuba diving sa ilalim ng karagatan? Heck, pero bago yon, do you even wonder what happened to your body when you do scuba diving? May idea ba kayo sa kung anong pwedeng mangyari sa katawan nyo pag nag-scuba diving kayo? Or familiar ba kayo sa salitang decompression sickness? Well, on this video, malalaman nyo na yan, kaya watch lang. Decompression sickness or also called generalized barotrauma or yung tinatawag na the bends ay isang injury caused by a decreased pressure that surrounds you. It's either in the air or in the water. Karaniwan ito nangyayari sa mga nag-scuba diving or yung mga deep sea divers. Although, it also can occur during high altitude and pressurized air travel. However, decompression sickness is rare in pressurized aircraft, such as those used for commercial air flights. So, paano nga ba nagkakaroon ng ganitong sakit? When you do scuba dive with compressed air, you're taking extra oxygen and nitrogen. Your body uses the oxygen, but the nitrogen dissolves into your blood, where it remains during your dive. As you swim back toward the surface after a deep dive, the water pressure around you decreases. Decompression sickness results from the formation of nitrogen bubbles that occurs with the rapid changes in the atmospheric pressure. To identify decompression sickness, a detailed history is obtained from the patient or the diving partner during assessment. So after assessing the patients or the diving partner, evidence of rapid ascent, loss of air in the tank, body breathing, or ito yung tinatawag na sharing of air with your dive body in order for you to keep breathing. Usually kasi nagmamalfunction ng oxygen tank or may tendency na nauubusan ito ng air. Other evidences such as recent alcohol intake or lack of sleep or a flight within 24 hours after dive. They suggested possible decompression sickness. Common signs and symptoms of decompression sickness may include fatigue, weakness, pain in muscles and joints, headache, lightheadedness or dizziness, confusion, vision problem such as double vision, stomach pain, chest pain or coughing, shock, vertigo, hypoesthesia, and loss of range of motion. Neurologic symptoms mimicking to those of a stroke or spinal cord injury can indicate an air embolus. Cardiac pulmonary arrest can also occur in severe cases and it is usually fatal. Any neurologic symptoms should be rapidly assessed, and all patients with decompression sickness need rapid transfer to a hyperbaric chamber. Hyperbaric chamber or hyperbaric oxygen therapy is a type of treatment used to speed up healing of carbon monoxide poisoning, gangrene, stubborn wounds, and infections in which tissues are starved for oxygen. So, ayun na nga. Nalaman na natin kung ano yung decompression sickness at kung ano ba yung mga senyales ng ganitong sakit sa isang pasyente. Ngayon naman, alamin naman natin kung ano yung mga dapat gawin or ano yung mga medical management for decompression sickness. So first and foremost, we need to secure the patient airway and ventilation. A patient airway and adequate ventilation is established and 100% of oxygen is given all throughout the treatment. The doctor can also order a chest x-ray to identify aspiration, and at least one IV line is started with lactated Rangers or normal saline solution. The cardiopulmonary and neurologic systems are supported as needed. If an air embolism is suspected, the head of the bed's patient should be lowered. If the patient's clothing is wet, remove the patient's clothes and keep the patients warm. According to Ude et al. By year 2015, transfer the patients to the closest hyperbaric chamber for treatment is initiated. If air transport is necessary, low-altitude flight such as 300 meter is required. And lastly, if aspiration is suspected, antibiotic agents and other treatments may be prescribed by the doctor. At dyan po nagtatapos ang video ito. I hope na marami kayong natutunan at pwede nyo ring ma-share yung kaalaman na nalaman nyo sa video ito. Maraming salamat sa pakikinig. Hanggang sa muli. Bye!